Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Atropine. Atropine is a prototype drug. It is a tertiary amine. This atropine will affect the nicotinic receptors, especially in higher doses. These are lipid soluble drugs and these are used as competitive antagonists on muscarinic receptors, and the atropine is actually a belladonna alkaloid. Even the skin can absorb the atropine in it. So atropine is also called as dihyoscyamine. Then pharmacokinetics of atropine. Atropine is 100% absorbed. Half of the atropine is metabolized. Rest half is unchanged. That is, it undergoes glucuronidation. Okay. In normal therapeutic dose, the drug does not enter the blood brain barrier, or it does not enter the blood placental barrier. So scope, yeah.
thank you and thank you for watching.